Helping in the fight against COVID. Flu season is here in full swing now. A lot to talk about this week, and so we want to welcome back medical expert Dr. David Winter from Baylor Scott & White Health. Good morning, Dr. Winter. Thanks for being with us here on New Year's Eve.
Good morning, Jason. Happy New Year to you.
I want to ask you, hopefully this will be a much better year ahead, but we're going to have to get through what's going on with this Omicron variant here. News reports have been suggesting that early symptoms of the coronavirus may be changing from what we've been hearing about for months and the past couple of years really now. What are you seeing?
Yeah, Jason, we used to see a lot of people that lost taste and smell as an early sign of COVID. We're not seeing much of that right now. Newer symptoms are drenching sweats, night sweats at the nighttime. That can happen. We're also seeing folks that have abdominal symptoms, nausea, vomiting, diarrhea, abdominal cramping. Those are more common. And a scratchy throat, more upper respiratory symptoms, less lower respiratory symptoms. So they're changing a bit right now as COVID tends to mutate and change out there in the environment.
We've seen a surge of COVID-19 cases here in North Texas and really all around the country, of course. Parkland Hospital here is said to be full of COVID cases right now. Just curious what you're seeing in your hospitals, in your office right now. Are you seeing this same kind of surge?
Yeah, Jason, I talked to a group of my friends, my colleagues yesterday. We're all seeing lots and lots and lots of outpatient cases. None of us have had to admit anybody so far. Now, I did call the Chief Medical Officer, Dr. Amy Wilson at Baylor downtown. She says they're seeing a slight uptick in hospitalizations, but not what they expected. So hopefully increased vaccinations, distancing, masking, those are going to make a difference. But right now, the jury's still out. We'll see what happens this next week.
So the silver lining there is that word outpatient that you're talking about. We're not actually seeing this huge number of people, even though we're seeing a huge number of cases. We're not seeing that same huge number of people at this point being admitted to the hospital. It's something that's being treated, and they're hopefully getting better.
Yeah, indeed. The cases do seem to be milder right now for the most part. Hopefully that'll maintain itself. I think a big difference, though, is a lot more folks are vaccinated than they were before, and the vaccinations clearly make a difference. So if you haven't been vaccinated, it's a good idea to get one. And if you want to increase or even lower your chance of getting severe illness, get a booster. We think those make a difference also.
Yeah, we do keep hearing that anecdotal evidence that most of the people who are in those hospital beds with COVID are people who were not vaccinated. I want to ask you this because this is something that I've struggled with some relatives who live in other parts of Texas who've been looking for tests. There's a shortage of tests right now. We know that. What do you recommend at this point for people who aren't able to go to the store and find one and who might not even be able to get one after waiting in a really long line?
Yeah, we're hoping more test supplies will be available in weeks to come. But for now, if you have a healthy immune system, if you've been vaccinated, if your symptoms are mild, you can just stay home. Drink lots of liquids, get plenty of rest, avoid other people. And then at the 5-day mark, if your symptoms are gone or minimal and gone away or going away with no fever, you can get back in circulation, although wear a mask for another 5 days. Those things work. Now, if you do that, Jason, you need to know about the severe symptoms. So if you happen to come down with severe shortness of breath, tightness, chest pain, confusion, if you have trouble staying awake, you're sleeping a lot, if you get bluish discoloration of your lips, your fingers or toes, you need to call a doctor or get to a near emergency facility. Those are the warning signs of COVID that may require hospitalization.
Some great, very helpful advice this morning. Dr. Winter, thank you for taking the time with us and Happy New Year. And again, hopefully 2022 will look a whole lot better for us on this front.
Indeed. Thank you, Jason. Happy New Year to you.